Hello, my name is Chisom Manajiku, and today I'll be presenting a case study based on a fictitious patient named John Doe. Jane is a 45-year-old female who presented with symptoms of fatigue, increased thirst, and frequent urination. My goal is to analyze her patient history, clinical test results, provide a diagnosis, and suggest a treatment plan. Jane has a history of hypertension, diagnosed 5 years ago during a routine checkup. She manages this condition with medication prescribed by her primary care physician. There is a significant family history of type 2 diabetes mellitus on her mother's side. Her mother was diagnosed with diabetes at age 50 and manages it with diet, exercise, and medication. Jane describes her diet as generally healthy, but admits to occasional indulgence in sweets and processed foods, especially during stressful periods at work. While Jane used to exercise regularly, her activity levels have decreased due to work, demands, and family commitments. Jane reports adequate sleep, but occasionally experiences disrupted sleep patterns due to work-related stress. Jane works long hours as a marketing manager in a competitive industry, sometimes leading to high stress levels and irregular eating habits. She has a strong support network of her spouse, children, and close friends, which helps her manage stress. Jane experiences moderate stress related to work deadlines, family responsibilities, and managing her hypertension. She maintains good mental health overall, but acknowledges occasional feeling of anxiety and fatigue, particularly during periods of increased workload. Based on initial assessment, my hypothesis was that Jane might be suffering from type 2 diabetes, primarily due to her symptoms and family history. A glucose determination test was conducted to measure Jane's blood glucose levels, which is critical in diagnosing diabetes. Here's how the test was performed and interpreted. Jane fasted overnight for at least 8 hours to ensure that her blood glucose levels were not influenced by recent food intakes. A blood sample was drawn from Jane's vein using a sterile needle and collected A glucose determination test was conducted to measure Jane's blood glucose levels, which is critical in diagnosing diabetes. Here's how the test was performed and interpreted. Jane fasted overnight for at least 8 hours to ensure that her blood glucose levels was not influenced by recent food intake. A blood sample was drawn from Jane's vein using a sterile needle and collected in a test tube containing an anticoagulant to prevent clotting. The blood sample was then sent to the laboratory where it was analyzed using a glucose oxidase method. This involves using an enzyme that specifically reacts with glucose to produce a measurable color change, which is quantified using a spectrophotometer. Jane's fasting blood glucose level was measured to be 180 milligrams per deciliter. Normally, fasting blood glucose levels should be between 70 and 100 milligrams per deciliter. Levels above 126 milligrams per deciliter on two separate occasions indicate diabetes. Jane's level of 180 milligrams per deciliter clearly indicates hyperglycemia, suggesting a strong likelihood of diabetes. Next, an enzymatic kinetic test was performed to assess enzyme activity, which can help detect metabolic disorders. Jane's blood sample was used for this test as well. Specific substrates were added to the blood sample. Enzymes in the blood react with these substrates, and the rate of these reactions were measured over time. The activity of enzymes like alanine and aminotransferase and aspartate aminotransferase was measured. These enzymes can indicate liver function and overall metabolic activity. Jane's enzyme levels were found to be within normal ranges, which ruled out other potential metabolic disorders. Normal enzyme levels suggest that her symptoms are not due to a metabolic enzyme deficiency or liver disease. Urinalysis was conducted to examine Jane's urine for abnormalities, and here's how the test was performed. Jane provided a midstream urine sample, which was collected in a sterile container. The urine was tested for various parameters, including glucose, protein, ketones, and microscopic examinations for cells and crystals. A dipstick test was used initially, where a strip containing chemicals that change color in the presence of glucose was dipped into Jane's urine sample. For quantitative analysis, the sample was further analyzed using a urinalysis machine. Jane's urinalysis showed the presence of glucose in her urine, which is abnormal. Normally, urine should not contain glucose. The presence of glucose indicates hyperglycemia, further supporting the diagnosis of diabetes. Combining all test results, I found that Jane's elevated blood glucose levels and the presence of glucose in her urine strongly suggest that she has type 2 diabetes. The enzymatic kinetics tests rule out the other metabolic disorders. The fasting blood glucose level of 180 milligrams per deciliter is a clear indication of diabetes. The presence of glucose in the urine further supports this diagnosis. Normal enzyme levels indicate that her symptoms are not due to metabolic enzymes deficiencies. In conclusion, after thoroughly evaluating Jane's medical history and the clinical test results, I diagnosed her with type 2 diabetes. The diagnosis is supported by her high blood glucose levels and urinalysis results showing glucose present. To manage Jane's type 2 diabetes, prescribing metformin to help lower her blood glucose levels and adopting a low-carb diet to manage blood glucose levels, encouraging regular exercise to improve insulin sensitivity, regular monitoring of her blood glucose levels to manage and adjust her treatment plan as needed. Long-term management will involve continuous lifestyle adjustments and regular checkups to monitor her condition. The key takeaway from Jane Doe's case is the importance of a holistic diagnostic approach, combining patient history, symptoms, and multiple clinical tests allows for a comprehensive evaluation, leading to an accurate diagnosis. Early detection and management of type 2 diabetes are crucial in preventing complications and improving patient outcome. Regular monitoring and proactive treatment plan are essential components of effective diabetes management. By addressing health issues promptly and thoroughly, we can significantly enhance the quality of life of our patients, or rather for our patients. In summary, Jane Doe's case highlights the importance of a comprehensive diagnostic approach, combining patient history, symptoms, and multiple clinical tests to arrive at an accurate diagnosis by addressing her type 2 diabetes promptly and effectively. We can significantly improve our quality of life and prevent future health complications. Thank you so much for your attention. Have a blessed day.